After you have a baby, one of the biggest things that can cause anxiety is the bleeding that comes after. It can feel like it's never going to end, and honestly, it can be a little alarming. But what if I told you it's actually a sign of something incredible happening? Today, we are going to demystify postpartum bleeding, or as it's medically known, Lochia. Let's dive in and really get what's going on inside your body. I want to start with this quote because it perfectly reframes this whole process. This isn't something to be afraid of. Like Dr. Prashant says, this is your body's beautiful, meticulous feeling process, just made visible. It's a powerful sign that your body is literally rebuilding itself. Leaving the hospital and suddenly having to deal with this heavy bleeding at home, it can be really stressful. So let's pull back the curtain and get a clear picture of what is actually happening inside your body right now. So where is all this bleeding coming from? It's all from one specific spot, the place where the placenta was attached to your uterine wall. As soon as the placenta comes out, it leaves behind what is essentially an open wound. And let's talk about the size of this wound for a second because it really puts things into perspective. We're not talking about a little scrape. This wound is about 8 to 10 inches wide, roughly the size of a dinner plate. Yeah, when you picture that, the weeks-long healing process starts to make a lot more sense, right? So how in the world does your body stop bleeding from a wound that big without any stitches or bandages? Well, it has this absolutely brilliant built-in mechanism. Your uterine muscles are literally woven together in a figure-8 pattern. As your uterus shrinks back down, these muscles clamp down on all the blood vessels like thousands of tiny living tourniquets. It's just an amazing piece of biological design. And that discharge that you see, that's what's called lochia. And it is so crucial to know that this is not dirty blood. It's a completely sterile mix of old blood, some mucus, and a ton of white blood cells. They're basically your body's cleanup crew, all working together to heal that internal wound. Okay, so how can you track all this healing? How do you know it's going right? Well, your body gives you some really clear visual cues. The way the color of the lochia changes over time is basically your own personal progress report. The whole thing unfolds in 3 pretty predictable phases. First, for the first few days, maybe up to day 4, you have what's called lochia rubra. It's red and it looks a lot like a heavy period. Then you'll shift into lochia serosa. This is when the flow gets thinner and turns more pinkish or brownish. And finally, you get to lochia alba, which is a yellowish-white color, and that's the final cleanup stage. Seeing these changes is proof that you're healing perfectly. Okay, so now that we get the why, let's get really practical. Instead of just worrying and guessing, here is a clear 5-point plan. These are objective things you can actually measure and track to monitor your healing and hopefully give you some real peace of mind. First up, let's talk about something that startles almost every new mother, the morning gush. You know that moment when you stand up after lying down for a while and you feel this sudden rush of blood? It's not a hemorrhage, it's just simple physics. Blood pools inside while you're resting, and when you stand up, gravity does its thing. Totally 100% normal. So, what about blood clots? Well, small jelly-like clots about the size of a grape are totally expected. But this brings us to a super important, very clear metric, the golf ball rule. If you pass a dense clot that is larger than a golf ball, or a few that are lemon-sized, that is your signal to call your doctor. It's a clear, black and white rule. Hygiene is so important, and this rule is simple but absolutely non-negotiable. Just remember the number 4. Change your pad every 4 hours. And that's even if it doesn't feel full. A damp pad is just a breeding ground for bacteria, and this one simple habit is your best defense against infection. Now, with all this blood loss, you're losing iron, which can lead to that deep exhaustion and even postpartum depression. So you have to be really aggressive about building your stores back up. The protocol is clear. Keep taking your supplements for 3 to 6 months, but never take your iron with milk or calcium because they block it. Instead, take it with vitamin C, like some lemon water, to triple how much you absorb. And of course, eat those iron-rich foods. Now this is a big one. That old tradition of 40 days of complete bed rest is actually dangerous. It can cause blood to pool up inside, which increases your risk of infection. The modern medical advice is the exact opposite. Gentle walking. Just for 10 or 15 minutes every few hours. It uses gravity to help your uterus drain safely and helps prevent dangerous blood clots in your legs. And please remember, you do not have to do this alone. In that fog of sleep deprivation, it is so easy to lose track of how much you're actually bleeding. Having a partner or a caregiver physically track your pad changes for those first 5 days is a total game changer. It gives you objective data and takes a huge mental weight off your shoulders. All right, it is time to do some serious myth-busting. There are so many unhelpful traditions floating around about postpartum care. It is time to replace all that fear-based stuff with some solid medical facts. Myth number 1. This idea that postpartum blood is impure and that you have to flush it out with hot herbs or special concoctions. The reality? Lochia is sterile, healing tissue. It is not dirty. Trying to force more bleeding can actually trigger a really dangerous hemorrhage. Your body knows the right pace to heal. Myth number 2. The fear that if your bleeding stops too soon, say by week 3, that bad blood is now trapped inside you. This is completely false. If you stop bleeding earlier than average, it's not a problem. It's a sign of excellent, efficient healing. It just means your body is ahead of schedule. And finally, the myth of aggressive belly binding. Tying your stomach super tightly right after birth doesn't actually squeeze out blood effectively. What it does do is create a huge amount of downward pressure on your pelvic floor, which can lead to serious long-term problems like prolapse and incontinence. Gentle support is one thing, but aggressive binding is harmful. Okay, now for what is arguably the most important part of this whole explainer. While this process is almost always normal, there are a few critical red flags. Knowing these signs is absolutely non-negotiable for your safety. This is the single most critical metric to burn into your brain, the 1 pad per hour alert. If you are soaking completely through a thick maternity pad in under an hour, and that happens for 2 hours in a row, do not wait. Go directly to the emergency room. This is the clearest sign of a postpartum hemorrhage. And here are the other immediate red flags. If your bleeding suddenly goes backward, returning to heavy and bright red after it had already gotten lighter, if there's a foul smell, like rotting meat, that can signal a uterine infection. If you get a fever over 100.4 with severe, sharp pain in your abdomen, or if you feel extreme dizziness, blurred vision, or a racing heart while you're just resting. These are all signs to get medical help right away. Trust your intuition. So let's just bring this all together. I know that seeing blood for weeks can be exhausting and worrying, but try to remember this. Every single drop is physical evidence that your body is doing something miraculous. It is rebuilding itself from the inside out after creating and sustaining life. This entire process just highlights what a crucial period of both vulnerability and incredible strength this is. It really leaves us with a bigger question, doesn't it? How can we, as a community, as a society, do a better job of supporting new mothers through this intense healing phase with clear, factual information and real compassionate care?